Hi, Rick.
Hey, boss.
How's life?
Great.
Well, the situation as I see it is things are not working out with what you're doing. CSS has given you two opportunities with funding. And the last I heard from my staff is that on-time carpentry went bankrupt.
Yeah, we weren't on time. We had some problems there, but we didn't go bankrupt actually because we looked at our financial situation and we realised that we were in a very competitive market. Construction is very competitive. It's a very rigid environment, and so we actually decided to close the company. So,
Well, I hear what you're saying, but tell me, my staff were telling me that this time you're asking for even more money. So I'm worried, Rick. Things haven't been working out. So what is it you have in mind this time?
okay. Now I'm passionate about people.
Yeah, I know, because I like you as a guy. I can see how hard you work.
Thank you.
But it's not working out.
Okay. Well, I've got some data. Okay. So some data. So this is some files that I've been looking at. I'll tell you what, boss. I'm looking at the home healthcare industry. Okay. Because for me, I just want to help people. And now I've looked into New York, where we're based, and home healthcare is an industry that's going to boom. Okay. There's a lot of people who require those services, and there are not many people willing to provide those services.
And what makes you say that? Because the ones that are currently in the market are not doing too well.
That's right. But I think there's scope to expand this market, and there's a lot of data that I have that I can talk you through it. But if I could just give you the overview, basically there's scope to expand this market in New York. There's scope to increase the standard of care for home healthcare providers. I want this company to be that company that increases the standard. When we increases the standard, number one, we're going to serve people with a better quality of service. Number two, we can charge more for that service. Because I don't just want my people to have a job. I want them to have a career. I want them to have a trajectory. I want them to have a ladder. I don't just want a job for today, but I want them to have a position that they can aspire to tomorrow and the day after that. And also, I want them to be connected to the business in that when the business succeeds, they succeed. So I want them to be able to get shares in the business. Sorry, you were going to say
Yeah,
something?
so we would love to support you, Rick. But tell me the specifics. Have you worked out?
Yeah, I have projected what we will make in the first year, and then I've also projected what we will make in the second year. And I think that your funding will be needed for the first 18 months, and after that, we're going to be completely self-sustainable. I think that in the first year, we can support 50 employees. And I think that it's going to grow rapidly because this service is actually not really provided in the industry. At the moment, the industry is almost like an employment agency. One person comes and you just allocate them to someone who needs home health care. I don't want that. I want to create a relationship between the provider of care and the patient. I want the same person to keep going back. I want them to I want it to be true healthcare, like a doctor. You don't want to keep changing doctors. You don't want to keep changing dentists. And you don't want to keep changing home healthcare workers.
You're right. Rick, I've been looking at this and I just don't understand. So, who owns this? There doesn't seem to be a clear command and
I'm glad you asked.
structure.
There's perfect leadership committees. There'll be one leader. We have to identify, leadership and everything, but there is very organized leadership. But the key thing I think you're looking for is who, owns the business. The employees will. So this will be their own business. So when they do, this is what I mean. They'll have a commitment to their job because it's their business. When their business succeeds, the profits go to them. That's what I want. I want high quality jobs, and I want to transform the industry of home healthcare. I want to help not just the people, because we're going to get the same people that our company is passionate about: the underserved, the underemployed, the poor. Those are the people that we want to work with in creating employment opportunities. But more than that, we're serving the disabled poor. So this is a twofold exponential win-win situation. Everyone is going to succeed. And I think that this company can hold a huge share in the industry and actually lift the standard and transform the home healthcare industry.